Welcome everyone to this webinar about algorithmic bias in healthcare AI. We'll start in just a moment, so bear with us and we'll be with you soon. Welcome everyone to this webinar on algorithmic bias in healthcare AI. We'll start in just a moment. Thanks for being with us. We'll begin soon. Thank you everyone for joining us for this webinar on algorithmic bias in healthcare AI. We'll just give people a couple more minutes to come in. We're still getting new participants, so we'll wait just a little bit longer and then we'll be with you shortly. So thank you everyone for joining us. We're really excited about this event, a webinar organised by the Australian Centre for Health Engagement, Evidence and Values at the University of Wollongong on algorithmic bias in healthcare AI, scientific accuracy and social justice. My name is Stacey Carter. I'm a professor and the director of the centre. We'll be starting very shortly, but first a little bit of housekeeping. So we are recording and the recording will be shared after the event. As audience members, your video and sound won't be turned on and the chat function's off, but the Q&A function is very much operational. We're hoping that you will use it to add questions throughout, and we'll have about half an hour at the end of the event to come to those questions. You can ask questions anonymously if you would like to, and you're also able to upvote questions if there's a question that you want answered. And all of the Q&A will be captured. So even if we're not able to answer in the time, we can potentially come back to you, and we also will have that question on record. So before we begin the content of the webinar, I would like to acknowledge country. So all of us who are in Australia are on First Nations unceded land today. I will read the acknowledgement for the country that I'm on, but you all will have a different acknowledgement appropriate for the land that you are on. So we acknowledge that country for Aboriginal peoples is an interconnected set of ancient and sophisticated relationships. The University of Wollongong spreads across many interrelated Aboriginal countries that are bound by this sacred landscape and intimate relationship with that landscape since creation. From Sydney to the Southern Highlands to the South Coast, from freshwater to bitter water to salt, from city to urban to rural. The University of Wollongong acknowledges the custodianship of the Aboriginal peoples of this place and space that has kept alive the relationships between all living things, The university acknowledges the devastating impact of colonisation on our campus's footprint, and we commit ourselves to truth-telling, healing, and education. So welcome again, everyone. As you know, this webinar is focused on algorithmic bias in healthcare artificial intelligence. This is the rough outline of where we're headed in the next 90 minutes. So we have a presentation from Dr. Yves St. James Aquino based on work that he's done, understanding the perspectives of different professionals on algorithmic bias. Then we have three fantastic panelists who will respond, and then we'll have an active Q&A for about half an hour at the end. So don't forget to put your questions into the Q&A at any time. So this, the next slide, please, Eve. Thank you very much. Before we tell you a bit more about the project, I just wanted to introduce our panelists. We're so fortunate to have three incredible scholars who are making enormous contributions on this topic. So we have Professor Rachel Thomas from QUT, Professor Jackie Leach-Scully from the University of New South Wales Disability Innovation Institute, and Professor Edward Santow from the UTS Centre for Social Justice and Inclusion. All of them you will hear from later, but we just wanted to express our gratitude that they're with us today. And we're really looking forward to the conversation. So this webinar comes from a National Health and Medical Research Council funded grant called the Algorithm Will See You Now. And a core focus of the work that we're doing for this grant is thinking about what it might mean to try to address the potential for algorithmic bias in artificial intelligence, particularly in a healthcare context. I wanted to acknowledge all of our fantastic collaborators on that project who've all made contributions to the work that we're doing together. And today we'll particularly focus on analysis that's been led by Yves Aquino. So on to introducing Yves. So Yves St. James Aquino is a doctor and a philosopher of medicine, and his research interests are in bioethics, public health ethics, and the ethics of artificial intelligence. He joined us at Achieve last year as a postdoctoral fellow to work on this grant. Yves has interviewed quite a diverse range of people who have a stake in healthcare AI, as you'll hear, whether that's developers or entrepreneurs, clinicians, consumers, service managers, regulators, people with all kinds of different perspectives. And this has given us new access to the perspectives of the people who are really implicated in developing and implementing healthcare artificial intelligence. So by taking these perspectives seriously, we think we can really see people's expectations and the judgments that they're making about healthcare AI. And this provides the context that we need to think well about the future of AI in healthcare. So now I'm going to hand over to Yves to explain what we heard from these stakeholders in relation to bias in healthcare AI. Thanks, Yves.
Thank you so much, Stacey, for that introduction. And thank you for everyone. Thank you for attending this webinar. And of course, advance thanks to our panelists. So today I'll talk about professional perspectives about algorithmic bias in healthcare artificial intelligence. But before I talk about our findings, just a little bit of background about artificial intelligence. Broadly, we consider artificial intelligence as computerized systems that mimic or replace some form of cognitive function that human beings are known to be good at. We're talking about problem solving or interpreting patterns or prediction tasks. It has different types. You have machine learning systems, natural language processing, speech recognition, computer vision, and automated reasoning. And they have varying degrees of maturity in terms of application in healthcare. Artificial intelligence in medicine at the moment is quite, there's a lot of research when it comes to diagnosis and screening, particularly with any kind of image-based diagnosis and screening. Artificial intelligence and machine learning systems are quite good at image interpretation. So at the moment, there are a couple of AI systems that have been approved in the US. There's one in Australia, and that's for mammography. The benefits allegedly of having AI systems incorporated or integrated into healthcare is that it can add support to clinicians. It can improve clinical skills by providing additional evidence. It can also improve accuracy. And the third one is having faster results. However, despite these benefits and promises over the past few years, there has been increasing concern as well as evidence of bias in artificial intelligence. We refer to algorithmic bias as technical and socio-technical errors in the system. So in a technical sense, bias can refer to systematic and repeatable errors. In a more socio-technical sense, these errors lead to unfair outcomes such as prejudice and discrimination, often of already disadvantaged groups. AI bias has also been noted, in human resource industry, particularly in discriminatory practices of hiring systems that rely on artificial intelligence. Bias has also been demonstrated in policing and surveillance, especially in the US, where AI systems unfairly replicate existing racist practices that target people of color. But what we are interested today are the AI biases that occur in medicine, with AI systems being found to perform poorly for communities of color, for example, and other marginalized groups. What we want to contribute to the discourse about bias is a study that engages with diverse professional stakeholders, as well as an in-depth analysis of their views about the problem of bias in AI. In terms of methodology, we recruited participants, ending up with 72 participants who knew enough to be informative about the potential implications of AI in their field, but did not have to be AI specialists. We wanted to access both AI expertise and clinical expertise. We were able to recruit clinicians, regulators or policymakers, data scientists, health informatics experts, consumer representatives, and healthcare administrators. The interviews took about between 20 and 80 minutes. It followed a semi-structured question round, and it covered different topics, including bias. Our analysis procedures included memo writing, coding interview transcripts, and organizing findings into a framework, as well as memo writing on each core concepts in the analysis. The first theme of our findings, I will discuss views about bias as a problem. There were 3 general responses to the charges of bias in healthcare AI, with the first view being supported by the majority of participants with diverse expertise, including clinicians and regulators. We refer to this view as the bias critical view, and it's based on the potential harms of algorithmic bias that range from compromising patient safety to perpetuating existing health inequity. Participants implied that such harms could undermine the promises and benefits of healthcare AI. So even if an AI is more accurate, at least for some groups, it will be useless if it leads to harming patients in other ways. Such view is illustrated by the statement, so there's structural discrimination built into the healthcare system as it is, partly because the research and trials are focused on certain demographics. So that's one thing. And then the system itself is a bit biased, just in the way they triage patients. And whatever biases exist, AI will continue to perpetuate it. The second view we refer to as the bias apologist view. In here, participants were also diverse, and there were no clear patterning in terms of expertise. Participants acknowledged that in contrast to the bias critical view, the bias apologist view deemed that AI would still be beneficial despite bias being a problem. Participants who held this view argued that bias was already an ongoing problem even among humans, among clinicians, and AI bias was still preferable over human bias. This is illustrated in the statement. First of all, I'd say what? And doctors aren't biased? I'm sorry, don't get me started on doctor bias. We're used to hurting people the old way with biased old doctors. Now we've got a new set of biases. What are we going to do with them? But it is a valid point. The third view, the denial view, it was held by the least number of participants, which included developers and entrepreneurs. Based on this, there was a misconception that bias and harms of bias only existed in jurisdictions like the US, not Australia, or fields like policing and criminology, but not medicine. Some even claimed that bias was not likely to occur in medical diagnosis because imaging technologies are objective. As illustrated by the statement, I can only tell you that in radiology, if we do a CT scan on your brain and on my brain, it will look exactly the same with a variation of black and white pixels. But a rib fracture is a rib fracture. It doesn't matter if you're black or white or green or blue, or whether you're Australian or Chinese. There is also a second implication to these kinds of claims. Not only are medical diagnostic tools objective, but some participants even claim that the human body as a target of observation consists of features that are universal and do not vary regardless of which social group you belong. The next part of the finding would be arguing for actions or inactions on bias. And there were at least two views implied by the participants' positions when defending AI against the charges of bias. The first, on the right side of the slide, the red boxes, is the view that actions are not required to mitigate bias. And this was held by participants in the bias denial view, and some participants in the bias apologist view as well. These participants were mainly developers and entrepreneurs or clinicians who themselves are developing AI. And on the left, the view was the view that actions are required to mitigate bias. And under this view, there were two subcategories, which I'll explain more in a bit. But do note that only group 3 properly aligned up with a single position on actions. That is, they believe that actions are not necessary. Group 2 participants and group 1 and group 2 participants were distributed across the two subcategories of whether actions, in supporting actions to mitigate bias. The main contention between these two subcategories is whether data scientists and developers have any sort of responsibility in mitigating bias. On one hand, we have participants who say that responsibility to mitigate bias is outside science and technology. As exemplified by the statement, I mean, from a science point of view, the way to address it is to make sure that we have good representation. So for this side, so we have participants who say that responsibility to mitigate bias is actually within the responsibility of data scientists. So the one on the left would be stakeholders who support responsibility among data scientists. And this is exemplified by the statement. So the social determinants of health is external to the data. We're actually not able to address some of those inequities that you refer to because it's not just there in the data. But then even when it is, we have to really think about what's the best way to leverage that data and build a model that reflects the diversity. In contrast, stakeholders on the right, or the purple box, they believe that any kind of action that can mitigate bias is really outside data science and the responsibility of developers. This is exemplified by the statement, I mean, from a science point of view, the way to address it is to make sure that we have good representation, that we have a wide enough number of samples from all possible classes or some groups and so on. But how do we ensure that? And that goes outside technology, that goes outside science, really, isn't it? So they start off from a similar position, but conclude in opposing directions, which is really interesting. Some of the participants who agree that we have to address bias presented different kinds of mechanisms and different approaches. And all these mechanisms can be categorized into two groups. One would be the social legal approach, and the other one would be the data science approach. Participants who suggested data science mechanisms were heterogeneous, but predominantly clinicians, developers, and researchers. And these mechanisms included data governance, validation tests, and use of synthetic data sets. For the other participants, predominantly regulatory and legal experts, they discussed or recommended social legal approaches in addition to data science mechanisms. These approaches included consumer and patient engagement, representation of marginalized groups, and legal recourse, such as if there is a discriminatory practice, then we can have legal recourse. While it may appear as if these two approaches are in opposition, we believe that we have to look at them as complementary approaches. Participants' views about the responsibility or role of stakeholders in addressing algorithmic bias were also wide-ranging, and stakeholders included developers, healthcare workers, manufacturers, policymakers, and regulators. What these kinds of mechanisms demonstrate is that any action or any mechanism to address bias might have to involve everyone who is involved at all, from the development, deployment, acquisition, regulation, and use of healthcare AI. The final theme of our findings would have to do about what exactly would be the role of sociocultural identifiers and data sets. This issue is particularly challenging. Participants had divergent views about the role of social data. For example, information about ethnicity, race, or gender, or other kinds of social data. A small number of participants, mostly researchers and developers, took an exclusionary view of social data in AI development. This view meant that in order to minimize algorithmic bias, social identities subject to prejudice should be masked or excluded in datasets. Reasons provided included preventing risk of assigning disproportionate weight to sociocultural identifiers such as race, religion, or gender identities. For some participants, cultural background do not really have any impact on disease, while other participants claim that non-biological variables are unreliable. There is an underlying assumption that when it comes to health and disease, that there is a clear boundary between biological or medical and non-biological or non-medical variables. Some participants, in contrast, held the inclusionary view, and these participants included entrepreneurs, clinicians, consumer representatives, and regulatory experts. Several reasons included ensuring that datasets are robust and representative of real-world populations, as well as providing means to identify which groups are currently underserved. Some participants, however, are wary that while they see the need for data diversity, they caution that it should not lead to unjust surveillance of already marginalized groups. Interestingly, majority of participants held neither exclusionary or inclusionary view, in a sense that they're really not sure what to do. According to these participants, data science relies on discrete categories, and sociocultural identifiers tend to belong to spectrum with no clear delineation between categories. So think of gender identity and gender diversity. Some data, such as race, or data on being Aboriginal or First Nation, are sensitive and require self-identification. Some people are not comfortable asking this information, and some are not even comfortable disclosing such information. And that is a barrier in making sure that people are represented. The third reason is that sociocultural data are just too complex. Every country and every language or culture will define categories differently. For example, countries define race and ethnicity in different ways. Some people use terms such as ancestry or nationality instead, and it varies in every industry as well. So these are just some of the challenges on why Most of our participants feel that they can't commit to either an inclusionary or exclusionary view. In summary, our findings show that there were divergent views about bias as a problem. We have the bias critical, bias denial, and bias apologist views. Secondly, participants disagreed about whether actions are necessary to mitigate bias, particularly about whether data scientists or developers should play a role in addressing bias. Finally, there were divergent views about whether to include or exclude sociocultural identifiers in datasets that are used to develop AI, with majority of participants admitting the problem is too complex and suggesting an urgent need for some kind of guidance on how to deal with data points that are socially and culturally defined or driven. And with that, I thank you.
Thanks so much, Eve, for a fantastic presentation. So I think we can probably stop sharing now, and I'll get all of our fantastic panelists to also turn on their video so that we can introduce you. So we now have a bit of time where our panelists are going to respond to Eve, and then we'll move to a more free-flowing kind of Q&A discussion. So we have three panelists, as you can see, who I'm going to introduce briefly. So Rachel Thomas is a professor of practice at Queensland University of Technology Centre for Data Science, and she's the founding director of the Centre for Applied Data Ethics at the University of San Francisco in the US. And as many of you will know, in 2016, she co-founded Fast AI, which is a very widely used deep learning course that had a mission to increase diversity through scholarships and international fellowships. So welcome, Rachel. It's great to have you with us.
Oh, thank you.
Our next panelist is Jackie Leach-Scully, who is Professor of Bioethics and Director of the Disability Innovation Institute at the University of New South Wales. Jackie's research interests focus on public moral evaluation of biotechnologies, on disability bioethics, and on feminist approaches to bioethics. And she's chief investigator of the ARC Centre of Excellence in Automated Decision-Making and Society. So welcome, Jackie. And finally, we have Edward Santow, who's Industry Professor for Responsible Technology at the University of Technology, Sydney at UTS. And many of you will also know that Ed is a former Australian Human Rights Commissioner, and he moved from that position to lead a new initiative at UTS on building Australia's capability on ethical artificial intelligence. So welcome, Ed.
Thank you very much.
So it's fantastic to have you all here, and we've got a couple of questions coming in already, so we encourage everyone to ask questions so that there'll be plenty for our fantastic panel to respond to. I might give each of you an opportunity just to respond to begin. So Rachel, maybe I could go to you first to give us a bit of a response to Eve's findings.
Sure. Yes, I wanted to start by just saying congratulations to Eve and the team. I think this is fantastic work. And I particularly want to highlight just how important this sort of qualitative work of these semi-structured interviews with a range of stakeholders is. So I've been looking at, I guess, kind of the opposite extreme when we have an over-reliance on metrics and what can go wrong when we're kind of purely using quantitative data. And this is something that's not unique to machine learning. So there's an example from England's healthcare system dating back 2 decades where they switched to using a number of metrics. And these included things like wanting to reduce ER wait times, which sounds like a good goal. But it was discovered that this led to a number of kind of gaming mechanisms where ambulances would ramp outside because if patients were waiting inside of ambulances, that didn't count as waiting in the emergency department. Or they would cancel scheduled surgeries so they could draft more staff into the emergency room, which helped in the emergency room, but created a cascade of other problems for people whose surgeries were canceled. And they also found that there was a discrepancy between what the hospital was reporting wait times versus what patients were reporting as their wait times. And so this kind of illustrates some of the problems of what happens when we over-rely on quantitative metrics. And a risk with machine learning is that we kind of turbocharge that. And so even though that can happen without machine learning the huge advances that we're seeing largely come from its ability to be so effective in optimizing various metrics. And so I think it's just really kind of really important as we use machine learning more to make sure that we are incorporating qualitative feedback and that we are incorporating these kind of qualitative information that comes through these interviews. And so I think that this work has kind of value on two levels, both in understanding how people are viewing the role of machine learning and bias in healthcare, but also kind of that we continue to gather that sort of data, since it's just kind of so essential for getting the full picture. Because we can't know in advance everything that we will need to measure or everything that will matter. And so it's important that we're always getting kind of outside feedback. By outside, I mean outside our quantitative channels. So I'll leave it there. Thank you.
Thanks, Rachel. And I think that these sorts of conversations give us an opportunity to start that connection between the people who are really expert at making the most of metrics and the people who are really expert at having these sociocultural conversations and trying to work out how we can connect those really fruitfully. So thanks, that's a really great contribution. Jackie, we might come to you next for a comment on Eve's findings.
Sure, thank you. And thank you again for the invitation to be here and engage in this conversation with the other panelists and with the rest of the audience. I'll just say a few things, I think, about disability in particular, because it shares some of the problems of algorithmic harm and bias as other forms of marginality do, but it's also got some very distinct issues and potential harms, I think. One of the features is that disability, at least as it's conventionally understood, is generally seen as a kind of minority deviation from a norm, and it appears like that, I think, in data. So in many databases, the information in the data about people with disability, of people with disability, will either be subsumed within a large mass of, in quote marks, normal data, because they are a minority, and in which case the people with disability disappear, or those data will be discounted. They'll be noticed, but it'll be discounted as being too much of an outlier, in which case people with disability also disappear. So, either way, they disappear. The heterogeneity, I think, of disability, the diversity of it, is another very distinctive feature about it. That's not to say that other protected characteristics or marginalized groups aren't diverse and heterogeneous and so on, but there's a kind of another order of magnitude of heterogeneity that comes with impairment. And that's just looking at the biological features here, because impairments can affect bodies and minds. It can affect sensory organs. They can affect mobility, cognition, stamina, lifespan. They can be mild. They can be severe. They can change over time. They can change with setting, etc. And that's not the same for something like sex or gender, and it's not the same for race. So this, I think, presents a particular challenge to the way that AI works, is systems of classification that algorithms ultimately reduce down to, which are generally binary choices. You're either in this category or you're not in this category. And that's very hard to do with something like disability. So one of my concerns is that the way that people will try to attempt to deal with that diversity and complexity could end up causing more harm from algorithmic bias rather than rectifying the problems. Because one way of dealing with it is to attempt ever finer, ever more granular classifications of forms of disability and impairment. And while at first sight that might seem to be a good thing, and you can say that an AI system might have the ability to deal with infinite levels of complexity or diversity, at least, in a way that a human healthcare worker can't. I also think that this kind of fragmentation or microgranulation tends to make the categories more abstract and more detached and disembodied from everyday life. And I think increasingly fine classification like that can't cope with thinking of disability in a more complex way as being something to do with some form of interaction between biology and environment. it will drill down on disability as a diagnostic category. And that's almost the opposite direction that our conceptual thinking about disability has gone over the last 15 to 20 years. And so I'll leave my comments there.
Thanks, Jackie. So that's starting a really fruitful line of inquiry, actually, between both of you about complexity and simplicity, about reductionism and an attempt to avoid reductionism, about how we deal with this in data systems that have a certain quality and can't actually necessarily be adjusted away from the kinds of binaries and reductionism that we might want to avoid. So that feels like a thread that we might pick up actually as we talk. But first, Ed, I wanted to go to you for a first response to Eve.
Thank you, Stacey, and I'd particularly like to congratulate Eve and Neermat and the other members of the team on the work that you're doing. I've seen quite a bit of work in this space, and the kind of sophistication, the sensitivity and the nuance that you're able to cover is really quite remarkable. So congratulations and more power to your left arm. I guess the point that I want to pick up really was something that Rachel mentioned a moment ago, and that's really in regard to machine learning. And, you know, sometimes the machine learning is the engine that is driving artificial intelligence and that is really changing the way that we make decisions across a range of areas, including healthcare and medical research. And I guess when you break it down, machine learning is, if nothing else, an incredibly effective generator of potential correlations. It finds patterns in data. And some of those patterns are meaningful. They can give us information that is truly useful, insightful, revelatory about the thing that we're studying. And the vast majority of those patterns are not. They are completely white noise. They tell us nothing useful about the world. All they do is set us off on a potential line of inquiry. And so really, I guess one of the things that we need to confront when it comes to the rise of AI and specifically machine learning is that we're seeing through these machine learning kind of applications, we're seeing these new patterns. These patterns are kind of being drawn to our attention. And that's potentially a good thing. But what we need to do is maintain a very critical eye when those potential correlations are drawn to us, because again, as any scientist will know, correlation is not the same as causation. And I think one of the most worrisome phenomena that I've seen in my own work on AI is a kind of a lack of critical scrutiny in respect of some of those kind of potential correlations that machine learning throws up. And that in turn has kind of led to new forms of unfairness and discrimination, or maybe it would be better to say kind of old wine in new bottles. That, you know, unfairness, discrimination has always existed, where machine learning is, in a sense, learning from kind of previous decisions, which themselves, human decisions, kind of infused with all of the vagaries of human reasoning. Then no surprise that can then in turn kind of bring, you know, into life again those old forms of unfairness, discrimination, and so on. So I guess to draw those strands together, machine learning is incredibly powerful, including in the health and medical research area, at bringing to the fore those correlations or patterns in data. What I think medical researchers are perhaps better at than the rest of society is not leaving it there. I mean, we know, for example, that you know, there are lots of medicines on the market today where we don't actually really understand precisely how they work on a chemical level, but we have very rigorous mechanisms for testing the correlation between you ingest this compound, you seem to get better. And we do that through blind testing, a whole range of kind of testing methods, right? And so we need to hold on to and indeed expand the way in which we kind of test those correlations that machine learning kind of brings to our attention.
Thanks, Seth. That's fantastic. So thank you all for those responses. And I thought before we go to a slightly more structured question, I might give you all an opportunity to see whether you wanted to respond to one another, actually. And perhaps, Eve, you might want to pick up on some of those threads in relation to your own work.
So it's really interesting, and I really resonate with the responses from the three panelists. And I think what I've noticed that's sort of implied by the responses of different stakeholders is that on one hand, some stakeholders acknowledge that AI systems is a social technical system. There is a social aspect to the technology. And then other stakeholders, mainly developers and entrepreneurs, sort of evaluate AI as independent of human values in the sense that the way it functions, the way it interprets data has no human history. It's as if it's not rooted on information that we gathered based on human judgments. So start thinking about clinicians' interpretations being coded and transformed into data sets, and those data sets being used to develop AI. They also sort of subscribe to the notion that AI is independent of human values upon deployment, in the sense that AI is objective, it's free from all these other, as Ed said, the vagaries of human reasoning, and it will not be impacted by human imperfections and the way we sometimes wrongfully judge things. So I think there's really this undercurrent contrast on how people view AI system and whether it's a social technical system or a purely technical system.
I think that's a great point, Eve, and that also relates to, I think, a point that Jackie was making around. So right now in machine learning, there is some interesting work happening on kind of as a genealogy of data sets is how it's framed, but really trying to unearth how were data sets created. Yeah, they're not just these kind of objective truths that drop down from the sky, but there are so many decisions that go into how things are classified, how data is gathered, which data is included, which data isn't. And I loved Jackie's point about also just how disability is not this binary category that's easily coded, and that when we are trying to reduce things into categories, we miss so much. And there is something kind of very inherent with data and trying to code things, and so many decisions that go into how they end up getting coded and what's overlooked and what nuance is lost. And so yeah, I appreciate both of you bringing that up about these issues of how data sets are constructed and how that kind of ends up forcing people to try to fit or be forced into categories that may not fully capture kind of their state and their attributes.
I suppose there's one other point that could be made relating to disability and the way that it's the same as, but not quite the same as, some of the other marginalities that we worry about. And in this particular instance, if you're looking at healthcare, there's obviously a way in which Eve's denial list, I think, could look at some category like sex or gender or socioeconomic status and so on, and could say, okay, these things influence, but actually they're nothing to do with the biology, which is what we're interested in really as healthcare workers. And you can't say that about disability. It's totally entangled with biology and with environment and with society and with attitudes. And so it kind of proves the point in a way that the other categories might appear to be more or less independent of biology or independent of health or independent of some kind of social category, but they're not. They're always entangled with each other. And part of the challenge is going to be teasing out the various contributions along the way.
Perhaps one quick reflection from me. I really like Eve's emphasis on the socio-technical nature of decision-making systems. And essentially what that calls on us to do is to be very well considered in the extent to which we, assign tasks to the machine and assign tasks to the human, and indeed assign oversight to the human. Thinking about this just before we started, because I was telling the story about my 4-year-old son. There's another story that it's a bit of an analogy, but bear with me. So my 4-year-old son was asking me a few months ago about horse racing. He's saying, well, what on earth is that? And I gave him this slightly obtuse explanation where I was saying, well, there's the horse and there's the human, and they kind of work together as a team and they race together and they see who wins. And it became really clear to me over the course of that conversation that he thought that it was the horse riding the human rather than the other way around, which is quite a sweet image. But the kind of long bow that I'm trying to draw here is that too often I think we're kind of heading in that direction in the way in which we engage with the machines that we ourselves have created. In other words, by assigning too much kind of autonomy, as it were, to AI without effective mechanisms for control and oversight, and indeed checking of the outputs, then I think we're really abdicating our responsibility to make sure that those socio-technical systems operate accurately and fairly.
Thanks, Ed, and thanks everyone. Now, I want to go to the elephant in the room, which is already to some extent in the Q&A, and that is whether bias actually exists at all. So one of the interesting things that Eve's analysis has raised is that actually not everyone who's building AI is convinced that bias is really a problem. Either it's not a problem in healthcare, it's not a problem in Australia, or it's just generally not a problem that we need to worry about, or it's a problem that is already in the sociocultural human world. And so we shouldn't have these high expectations of AI that it would somehow not be biased because humans are biased. So there were lots of ways in which people suggested that they were perhaps not convinced that bias was actually a problem. So Rachel, I know you've thought about and confronted this question quite a lot in your own work. Maybe you could kick us off with a conversation about the data science community and bias.
Sure, yeah. So first of all, I think that all data is biased. There's no view from nowhere, kind of to borrow from feminist theory, that everything kind of has a perspective. And as I was mentioning, there are decisions about how it's gathered. I'll often kind of hear from students sometimes of like, oh, give me an algorithm that will debias my data. And there are debiasing techniques, but you don't reach a point where there's not bias. And so a lot of, I think, really interesting work that's been happening in machine learning and fairness has been around just being more explicit about what decisions went in. So data sheets for data sets, a paper by Timnit Gebru. Dr. Gebru is coming from an electrical engineering background. And in electrical engineering, each component, like a resistor or a transistor, comes with a data sheet that tells you how it was manufactured and in what year and under what specifications is it safe to use. And she has proposed doing this with data sets, which I think makes a lot of sense, to kind of give more details about this is how this data set was gathered. And these are, specifications where it, would be safe to use in these contexts, but, maybe it's not a good idea to use it in these other contexts. And this is an idea that's still kind of formative in the machine learning community of, exactly what form this is going to take is still being decided. But I think it's a really helpful approach to kind of think about, okay, where does it make sense to use this? And this gets at some of the issues of, if you gather your data in, a urban area in one country, you may not want to go to a rural area in another country and use an algorithm you trained on that data because you have a very different underlying population. But just to be aware of, these are the attributes. So that's kind of one thought on understanding what bias is in your data set. And then I have to mention, because I do hear this argument frequently from some data scientists of either that we're just kind of encoding the data and this bias already exists, but it's not something like the machine learning algorithm itself is quote neutral. And it's important to note a few things. One is that there are examples where machine learning systems can actually amplify bias, and so they can end up training a model that is more biased than the underlying data. And so this has been seen, for example, in pictures. There was like an image data set where if you had a person in the kitchen, in most of the pictures, it was a woman, not a man. And the kind of optimal model ended up being even more wrong, basically, of, if it saw a person in the kitchen, assuming that was a woman. And that was kind of the way that minimized the error. So there is this risk of not just encoding bias, but also amplifying it. And then a second point about this is the algorithm neutral and the problems just the underlying data, is to recognize that algorithms end up being used often differently than human decision makers, and so it's not plug and play interchangeable of the human was making this biased decision and now we can have an algorithm make this biased decision. But for example, people are in some cases more likely to see computers as objective and to think that, oh, this answer must be correct because it's coming from a computer. Often many systems are taking out appeals processes when a computer is involved because it's part of a cost-cutting measure or because it's seen as objective. And so remembering that it's not plug and play interchangeable, that computer systems can end up being used very differently. In the interest of time, I'll stop there, but I'm happy to talk about this topic more, because it is something that I've thought a lot about and I think is very, very relevant for the issues that we're facing.
Thanks, Rachel. And I think we'll come back to it in the Q&A. We might pick up on something that you raised, Ed, around responsibility and kind of humans having some oversight of how we use these algorithms. So Eve's analysis shows quite diverse views on where responsibility should lie, and particularly whether there's any responsibility within data science or whether that responsibility really sits outside of data science, that kind of society, regulators, people external to building of algorithms need to fix the surrounding problems, and then that will fix the problem, that data scientists can't be expected to fix the problem. So what do you think about how we locate responsibility around addressing bias in AI?
Oh, look, I mean, there's quite a, this is going to sound a bit negative, there's quite a lot going wrong. And there's lots of responsibility to share around. So I'm going to start with myself. Until relatively recently, I was a regulator. We have the Human Rights Commission has primary responsibility for Australia's anti-discrimination laws, so very, very relevant to the problem of algorithmic bias. Now, if you engage in unlawful discrimination, essentially you treat someone unfairly because of their race or their age or their gender or their disability, it actually doesn't matter under our law whether you do that using an abacus and the most unsophisticated technology or a deep neural net or anything in between. It's unlawful. It is completely unlawful regardless of your means of doing so. There's no need to change the law. That law, like most laws, is outcome based. But regulators like me were too slow here in Australia, or have been too slow here in Australia and the world over, frankly, in enforcing those laws and making sure they're effectively applied, working with both affected communities as well as with companies and government agencies that are duty holders in making sure that they understand their obligations as they apply to algorithmic decision making. And so, there's really important work there to kind of lift the capability of regulators and the broader regulatory ecosystem to make sure that law that is there to uphold people's basic human rights, it's there to protect people. It's really fundamental that it works as the kind of underlying activities are changing a bit. So that's where I'm going to focus. But I also acknowledge, right, like it's the responsibility of anyone who makes the decision, and it's a decision, right, to use AI or machine learning system in the way in which they make decisions, to do so in compliance with the law. it's no excuse to say, oh, well, look, I'm sorry, it's a black box system. And so that's the way the system was designed. And so, yeah, I'm never going to be able to prove that, my system is not acting unlawfully or unfairly or in a discriminatory way. Like that's a completely unacceptable position. And it's legally unacceptable. And so that's something I think that people also have to wrestle with as they choose the technology that they are going to deploy in their work.
Jackie?
If I could, yeah. I think it's going to be, and it is and will be, absolutely essential to have those legal frameworks and regulatory frameworks, apportioning responsibilities, tracking them, and so on. There's no doubt about that. I think I'm going to be a little bit cynical, though, and say that I think most people will duck responsibility if they possibly can. And certainly most, I think, in a complex thing like healthcare system, they will try to sidestep it. And I'm interested in what will happen when, at the back of our minds, really, we know that, and healthcare systems know, and workers know that what's being offered through AI in healthcare is, an oversimplification or a crude version of reality, or has inherent bias, and so on. But just avoiding that takes too much work. And what AI systems appear to be offering are clean. Thank you. Somebody's pointing out no one can hear me. Thank you. There should be an AI little bot popped up to say, Jackie, you're inaudible. That AI is providing something that is, not just clean and objective, but is easy and something that we don't have to think very hard about in the course of the day. And that's going to be part of the appeal to the workforce, I think, in professionals in a whole range of areas. And it's complicated, particularly, I think, for disability, which is, we're talking about healthcare here. And it's not just about disability too. We're talking about healthcare here, but a lot of the stuff that is going to be done with AI diagnoses, let's say, will spread into other domains. So that information will be used in service provision for people with disability, who have different priorities, would maybe intervene differently. But the simplest thing is going to be take what system offers and use it in another. And I think there's an enormous potential there, not just in disability, but for other marginalities and minorities as well. Enormous potential for, for injustice and for falling into the gaps, and for an individual just being too complicated for systems to want to deal with.
So that's quite a good segue, Jackie, into thinking about this problem that Eve has raised, where a lot of the people with data science expertise that Eve spoke to really were grappling with that problem. Eve, you might want to quickly gloss those conversations that you've had, which have really raised persistent problems.
That's right. And in fairness to there are some developers and people working and entrepreneurs and vendors as well. You can hear the genuine interest and the genuine empathy that they have with the problem of bias. But once they start, you can see it in their faces. Once they start talking about social identity, such as race and ethnicity and gender diversity, you can see that it's hard for them to grasp the concept, for example, of gender identity, an identity that can change over time, or a category that has no clear boundaries. So as Jackie said, when it comes to non-binary identities, is that even a category when it refuses to be categorized? So all these, and then people say that we do have multiple identities. Which of these identities should we include if we want to diversify our data points? So there is interest, there is strong interest to deal with the problem. And people have been calling, it's like, yes, the one solution for bias would be to make sure that we have diverse data set, that we have representation. But the question of what does diversity look like? How do we operationalize the idea of representation? How much representation? What would be your numerator and denominator if you're talking about proportionality? So all these questions, I think, are really difficult to the point where a lot of them just sort of put it in the shelf, like acknowledge it, and then sort of move on. But yes, it's a growing conversation and discourse, but in terms of concrete steps, it's still very hard.
Rachel, you might want to respond to that kind of challenge, that challenge with dealing with the complexity of data, and then Jackie, you might want to follow that up.
Yeah, no, I wish I had an easier solution to this, because I agree it is a really complicated and messy problem, and and that there is no perfect solution, but we shouldn't let the perfect be the enemy of the good. I think two things that do tend to hold us back a bit are, one, the difficulty of interdisciplinary collaborations. And I know that many people are giving more lip service to the value of interdisciplinary collaborations, but I think it's still very difficult. And I think often the incentives and institutions are kind of set up against them, where in academics, often kind of work that's not strictly in your field is seen as lesser than, and so that can make it difficult. We've also seen, so I lived in the US most of my life, but I think this was a trend across the West, that in the past 2 decades, there was kind of this glorification of STEM and kind of a dismissal of the humanities and social sciences, which I think we're seeing some of the negative fruit of that now, of just the humanities and social sciences are incredibly important, particularly in tackling problems like this, but people have been very siloed, and then, these certain fields have been treated as kind of lesser than. And so all these things, I think, make the interdisciplinary collaboration that we need now harder to have happen. And then we're also still kind of, I would say, in the very early stages of educating data scientists more on the ethical challenges. So when I was at University of San Francisco, we added a mandatory ethics class to the Masters of Data Science. But this was just a few years ago, and that was still a relatively new thing to be doing. And there are, a ton of, I would talk to a lot of people that are like, I really care about these issues, and I've read news articles, and I don't want that to happen to my product of, producing some kind of racist output. But really, people not feeling equipped to address it, and that I think we're still kind of in the early stages also of better equipping people. And then I want to second what Ed said about, regulation is going to be a crucial component of that as well, and we're in the early stages of getting that lined up. So it is hard, because these are tough problems. They're going to require interdisciplinary collaboration, and for many reasons, I feel like kind of we're in the early stages.
Thanks, Rachel. And Jackie, maybe as you respond to this, we could pick up on a great question from Heike about the normative hegemony of the medical establishment, as Heike expresses it. So that the medical establishment is very focused on fixing people, that it's inherently ableist. So this isn't just about AI, it's not just about data, it's about the medical context in which this is occurring. And Taylor actually also raises a great question about historical treatment of minorities, of marginalized people, and how those historical stories, things like Tuskegee, for example, create distrust in healthcare itself, let alone in healthcare AI. So we have this long historical story that also might inform people's willingness to trust AI. Maybe you could pick up on those threads in your response.
Yeah, no pressure. I think that it was mentioned that there's a focus on what we would call the medical model within healthcare, and to an extent, I don't want to say no, that's wrong. The medical approach is in many cases the appropriate one to do, for disability as much as anything else. How you build in the growing, I think what there is now, an embedded awareness of that disability is more than just a medical condition, and that is so much a function of those interactions. I think there is potential for building that knowledge in, but it requires the knowledge in the first place to build into the algorithms, to build into the system so that they can use incoming data appropriately. So that's a little bit of something to do with interdisciplinarity, but it's also to do with respecting different kinds of knowledge, and particularly respecting lay knowledge, and the phrase that people with illnesses or people with disabilities are experts in their own condition. Now, I think it's difficult enough, as been said, for input from outside of data science to come into some of the thinking, because there can be a lack of expertise, or sometimes just the dismissal of that kind of expertise. But it's amplified manyfold if you're bringing in knowledge from outside the academic field altogether and trying to get an understanding and appreciation of knowledge that's about how somebody's life is like, which may be part of the answer to the problem that you're setting, that you want to have as your output from your system. But getting that in there in the first place is, I think, difficult. And it connects, I think, with an issue which comes up with empirical research into, particularly, I think, into non-specialist responses to AI, automated decision making. Stacey, as you know, and others know, I have in the past done quite a lot of empirical work with lay people, non-specialists, around medical issues, and particularly reproductive and genetic technology. And even without understanding or grasping the technicalities, I've found that most, in quote marks, ordinary people, members of the public, can kind of grasp what we're talking about when you talk about genomic testing, genetic testing, reproductive medicine. It connects to families, it connects to illness and so on. But in trying to do the similar kind of work around AI, its presence in our society and in healthcare and elsewhere is at the moment so intangible. It's really, really hard to give people a hook to hang it on, to think about their responses, because of that intangibility and lack of awareness. And that's becoming a real, I think, methodological problem for us. And I'd be interested to know if anybody on the panel or anybody in the audience has encountered that too, and what their thoughts are.
Eve, would you like to respond to that question from Jackie?
It's really difficult. I can't even begin to imagine how to address it, but I think the important thing is to start really talking about it, and not just lip service. This is the problem. These are the issues, and start breaking down the problem honestly and start doing the work. I know that there are a lot of papers being written and acknowledging bias and the difficulties of people with disability and communities of color and gender diverse individuals. But I think, it's high time that we act. But in terms of how to approach that, it's still very difficult to say. But I just feel it, for me, I just know that, it's really time to act now instead of theorizing.
I was going to share kind of a sad example. Comes from IBM Watson in the US. Several years ago, there was kind of this huge marketing campaign that was really disconnected from what the underlying technology was. And so then several kind of investigative news articles came out of patients that really thought this technology could do things that it couldn't, and were very, very disappointed, and kind of had this broken trust around, okay, but the ads really implied this. And I think this is an ongoing problem with AI, and there's kind of this misalignment where it's kind of in the interest of tech companies to make it sound like, quote, magic, and to often project this aura of, ordinary people can't understand how amazing this is, and people receive a lot of messages, which I think are false, that are, you're not smart enough to understand how this works, and so you have to kind of just blindly trust us, and so that I think feeds into. So we kind of have a double distrust issue, because we do have all the, ongoing racism and sexism in medicine, and people being misdiagnosed and not getting their symptoms taken seriously. And then we also kind of have this issue with AI overhype. And so I think people are often kind of hearing stories at the extremes of either it's magic or it's terrible, and don't have you know, I think increasingly we need people to have a level of AI literacy, but that has not been provided through society. And it's totally understandable that most people don't have that, but that people aren't able to evaluate what's reasonable and what's not, what sort of things could we expect these technologies to do, and what are, you know, issues to look out for. And so, yes, there are a lot of problems here.
Just jump in on that point. I think I agree with everything Rachel just said, and really, there's that old cliche about with interdisciplinarity, that you've got everyone in the room speaking English, but they're all speaking different languages. And I think that that's happening a lot, particularly in issues like algorithmic bias. So I've got a nice little example of this as well. We did this great piece of technical research with some colleagues at Sydney Uni at the Gradient Institute, with Data 61, CSIRO, and a few others. This was when I was still at the Commission. And we were looking at this problem of algorithmic bias. And there were a series of conversations where I knew that I'm a lawyer, right? And I knew that the kind of data science experts were being very patient, and that I could tell that their patience was just about to kind of break. And eventually they would say, just tell us the number. If you want, 50% of the kind of group to be categorized, 50% of say customers to be female and 50% male, we can do that immediately. Stop talking about all of this complexity about fairness and the various different elements of the test, because we're sick of it. If you want 60% to be women and 40% men, we'll happily do that. We just don't want to think about it anymore. We want to go back to optimizing our system. And I think that is really, really interesting. And I sound unsympathetic. I'm not. I do get where they're coming from, because the law itself is quite tricky, and it's not super scientific. It's not susceptible to a kind of arithmetic solution. But that's the world we live in, and the alternative, frankly, is worse. So I think what we need to do is, as Rachel says, people like me need to increase our literacy in respect of things like data science. But it goes both ways. So the technical experts also need to be often a little bit more inquiring and inquisitive, I should say, about the context in which their systems, the systems that they are building, are to be deployed. Because if that combination happens, you're much more likely to build kind of decision-making systems that will uphold people's basic human rights, because they will better understand us as humans.
And can I add something to that, Stacey? What Rachel said and what Ed said. There was a recent interview with the IBM CEO about why Watson failed. And in so many words, what the conclusion was, they realized healthcare is different from other technology sector, and that it's far more complicated than they expected. So I think that's also speaks, as Ed said, it goes both ways. Technology companies and social media companies, information tech companies cannot assume that their success in one sector will mean success in the health sector. There is a lot of things that make healthcare system complicated.
I want to pick up on some objections from the questions, because I think it's really good for us to tackle those head on. So, and thank you everyone who's adding your questions to the Q&A. So the first objection, and I'm doing a bit of reading between the lines, so forgive me, audience. There's a set of objections that are around, we're only looking at the fact that the algorithm's biased. We're not actually paying attention to the other good things about the algorithm. And isn't it reasonable for us to trade these off? So Ian asks, for example, Ian Scott, are we setting too high a bar for AI to be totally bias-free if studies show that the AI significantly improves decision-making over what we do now? And that might actually also be the case for people in minority groups. So a kind of thinking about how do we weigh up bias versus performance, and if something's performing really well, how do we think about the fact that it might be biased? And Digital Health Lab added, well, maybe actually what the AI is doing is making this bias really explicit that was always there, and actually giving us an opportunity to examine it directly. So there are ways that we might make an argument that that actually just piling on AI for being biased is a bit unfair, or we should pay attention to other things. I wonder what people on the panel think about that.
I might jump off on this one. A couple of observations. One, I think we should be very pragmatic. That is, if a particular form of decision making, be it one that the humans are in charge of, the machines are in charge of, is provably better and fairer and so on, then generally we should go with that. Second observation is there's sometimes a bit of a straw man here, which I'm going to be very blunt, I think bespeaks a bit of lack of knowledge regarding how our law works. So there is never a requirement under our law for completely bias-free decision-making. That is not what anti-discrimination law requires. It's just a complete misunderstanding of anti-discrimination law. It's really about an unjustified treatment of a particular person for a particular, with a particular protected attribute. And that's the critical point here. And that's why I was saying a moment ago, those analyses are not usually susceptible to a very simple arithmetic conclusion, right? It's not simply about making sure that you have 50% male, 50% female customers or whatever it happens to be. It's actually looking at the particular experience of the individuals who are affected by the decision-making process. And there's a margin of error that is built in, or a margin of appreciation that is built in to the law. And that means that you don't have to be absolutely perfectly unbiased. There's a bit of a kind of a something I don't usually talk about publicly, but I will here. My late father was a lawyer like me, but a much better one than me. He ultimately became a judge, and we didn't usually talk about his work, his professional work. But actually, just before he died, I asked him, well, what do you think makes a good judge, good human judge? I was obviously saying. And his answer has always really stuck with me. He said, look, I think a good judge is someone who can suppress their prejudices. That really stuck with me because what is bound up in that kind of worldview is an acceptance of the fact that we all are motivated by both kind of rational as well as irrational, sometimes very base motivations. If we pretend that those base motivations aren't there, then we will probably just kind of have them leach out. But if we accept that they are there, if we rigorously look for them and then try our hardest to make sure that those are not the things that we act on, but rather we act on much more noble motivations, then I think we're in a much better place. And that is what we expect of human decision makers, and that is all we expect of machines.
Jackie, did you want to add something to that?
I think it is probably unfair to, quote marks again, pile on AI. On the other hand, there's times when you look at the amount of overclaiming by some aspects of AI and sort of think, well, you can take this, you can take the criticism because of where the claims are coming from. I don't think data scientists, I don't think lawyers and so on really expect it to, AI to be 100% totally unbiased. It's the way that that implication is within some of the claims and some of the speech about AI. And I think the comment that in many ways it's helpful in bringing those biases that are there to light is, it's a very opposite one. It's a very good one because, Ed, your father needed to know what his prejudices were in order to know when to suppress them and how to suppress them. So it's salutary to be at this stage where he's dragging out, okay, well, maybe we can't rely on the almost awe that we've had about the potential for machines to be so much better than us at making neutral, objective, clean, shiny decisions, and to come to a more realistic understanding of what their limits are, what our limits are, and how best we can work with each other. I mean, one of the projects that I've been involved with has been looking back on, not within the healthcare setting, but automated assessments about benefits for robo-debt, as it's called in Australia, which is kind of an unfortunate name, because that then spreads into a whole load of that contamination, into a whole load of other areas of automation as well. But in those discussions, it was pointed out that if you have, as many cases of assessment of need for disability has, basically a human sitting there with a laminated sheet of questions, asking those questions and only being able to put yes or no at the end of it. That is an automated decision-making process, because there's so little so little wiggle room around that. So the issues that we've been facing are not new, but they are being presented in a way that's really putting them into our faces, and that need to be resolved rapidly, to the extent that we can. I'm not over optimistic on that one either.
And Rachel, maybe we can connect that through to a question that's had a lot of upvotes actually from Wendy, which is, what do we do about the fact that there might still be those persistent beliefs that a lot of these data can actually be unbiased, that a radiological image is objective and doesn't carry any of that sociocultural meaning with it?
Yeah, I mean, that is difficult, in that I think it's a deeply held belief by a significant number of data scientists and technologists. So that is kind of an area where it's going to take I don't know, kind of ongoing education and learning, and as Ed spoke about, kind of this needing to learn the other side. I think there's also an issue with many data scientists not necessarily understanding all the kind of sociocultural issues that arise in medicine, and even just kind of all the research on existing bias in medicine, and on kind of delays in treatment, and patients of different races or genders being treated differently, and also kind of struggling to get accurate diagnoses, struggling to get their symptoms taken seriously, and how all this ends up filtering into medical data, into the construction of medical data. And so I think that some of it is kind of a lack of understanding on the part of we data scientists, and I include myself in that, of really understanding kind of how like the sociological side of medicine works. And I think that relates to, I'll just say on the previous question briefly, I think part of what that was getting at is maybe why is there this extra scrutiny on machine learning? And the first I will say, like, I think that scrutiny is important on medicine as well, and that's something I've written about these issues of bias and misdiagnoses and delayed diagnoses, even just with human doctors. But I think when we're kind of putting them into machine learning systems, we have these risks of amplification, also a risk of we're kind of encoding things right now. And so I think we're at a really kind of crucial inflection point. I think once we build these systems, it's going to be much harder 10 years from now to be like, oh, we need to go back and change everything. I think it will be easier now to try to get it right as we're creating so many new systems rather than wait. As well as just the scale that machine learning happens at. Machine learning and automation really kind of let you automate things at scale in a way that even though human doctors are biased, there's variation in those biases, and there's a lot of kind of variation from individual to individual. Whereas when you build an automated system, you can really kind of scale the same thing. So yeah, and maybe it sounds glib because I know it doesn't fully answer it, but I think it is. We do need a much a deeper understanding. I'll also say that collaborations really need to be integrated end to end. And there was an interesting paper, actually probably my favorite paper of 2021 was everyone wants to do the model work, not the data work, which is a great title. And it was they did interviews with, can't remember the number, dozens of machine learning practitioners from many different countries. And something they found is, and the people they interviewed generally wanted to do the right thing and cared about ethics. But some of the things that had gone wrong in their projects involved when there wasn't, I think, a deep enough collaboration. And so even though they often did have partners in, different, and actually some of the fields were medicine or wildlife conservation, they did have partners, but when that was not a kind of very integrated end-to-end collaboration, but was more just like, oh, they're getting the data for me and passing it off, or, and maybe they'll come back when we're debugging, that could lead to kind of very serious errors, even though that was, of course, nobody's intention. So I will say also kind of trying to have those collaborations be integrated is another key step.
Rachel, and one of the commenters actually has suggested that we need to have social science and developers working together. So can we go to the large data set question, because that's come up a couple of times as well. So Olivier's asked a really interesting and important kind of logical question. How do we deal with the fact that artificial intelligence needs massive data sets to be built, but we're talking often about people who are minorities? So Olivier's argument is actually it's quite hard to have adequate representation of a minority in a massive data set when there's not very many people in that minority. And then an anonymous questioner has pointed to the Mayo Clinic's attempt to build a database of 10 million de-identified patients, and has asked if there's any equivalent in Australia. And I don't actually know the answer to that question, but some people might have more knowledge than me. So that problem of large data sets and minorities inside of those data sets that Olivier raises, I wonder if I could throw that to someone from the panel to address.
I can try. So I think that for my gut response to that is acknowledging and being transparent about the limitation of your data sets would be crucial. Of course, it's not possible to represent everyone if you want your algorithm to be accurate. So I think just being transparent, these are the characteristics and demographics of our data sets, and making it clear. The assumption that you don't say that is that people will believe it applies to everyone, that it works for everyone. When in fact, especially when it comes to healthcare system, the assumption still is, if people are talking about a patient or the average patient, it's usually a certain race, it's a specific type of gender. So I think we have to challenge that. And if we can't represent people, then at least acknowledge that you are not representing these groups, and say this works for people in urban areas who are in this level of income, who are of this particular social group. So I think transparency has to be part of the statement.
Thanks, Eve. And someone else might want to pick it up. And there's also a really interesting point about identities that we may not want to disclose when data are being collected, and the implications of that in thinking about this problem. Jackie, you might want to take that one on.
Yeah, I mean, obviously, some identities, particularly stigmatized identities like disability, people may not want to disclose that, may not be part of the set of data that they're presenting to the outside world, let's say. Done it again, haven't I? Thank you, Stacey. It may not, that something like a stigmatized identity may not be part of the data set that people want to present to the outside world. I think one of the really interesting questions, again, which maybe can be grateful to AI and to massive data for presenting to us, is when we're talking about marginalities and minorities and the lack of data, representative data from those groups. And then you think about the kind of groups we're talking about, which is maybe women, which are hardly a minority. We know that there's been a historical problem there about lack of acquisition of data from medical data, healthcare data from women anyway, but that's, it's not about the numbers. If you have something like 1 in 4 people in the population eventually experiencing something that can be labeled a disability, again, it's not about the size of the group. So it's something to do with the interest that we have in that group and in that presentation of that piece of data. which it throws the question back on us and makes us rethink, how is it that we are apportioning those categories? How are we collecting this data from those populations? Sometimes it's to do with the popularity of a particular health condition, or in genomics, it's the popularity of a particular gene. Lots and lots of data on some particular genes or genetic conditions, very, very little on some others. So we need to scrutinize some of those baseline assumptions about there's not much data here because it's a minority group. I'm not saying that there isn't a problem, and I'm not saying that there's an easy answer, but it takes more than just saying we need to up the numbers to reflect the size of the group.
I'm sorry, we've got 2 minutes left. So what I might do is actually very quickly throw to, now that Jackie's given us a bit of a conclusion, to Ed and Rachel and then Eve, just to make a final comment before we ring off. So maybe Ed first.
Just picking up on Jackie's point, I mean, the kind of brief history of AI so far is littered with problems where we've just kind of gone for a kind of a solution of convenience. So on the data issue, we saw that with, for example, facial recognition applications where the cheapest, easiest source was ImageNet, and it was mostly people who look like me, so white middle-aged men. And so, yeah, surprise, surprise, the machine learning system got reasonably good at recognizing people like me, but not other groups. And the problem there is simply one of laziness, maybe being a bit too cheap. We need to really, I guess, respect the value that is placed in having diverse data.
Thanks, Ed. And Rachel, any final thoughts?
So I wanted to respond to the question just briefly. So with Fast AI, the goal of my partner, Jeremy Howard, who's kind of world-renowned in machine learning competitions, our goal is actually to focus on what you can do with small data sets. And so we think the big data has often been overhyped, and there's definitely some benefit to big data sets. But again, you have to remember that a lot of the major tech companies, it's in their interest to say, well, you have to have a Google-sized data set if you want to do anything interesting, because that's what they have. However, there's actually a lot you can do with a smaller data set and with small compute power, and that often forces you to behave in more creative ways. And there are even competitions we've won kind of by being scrappier and more creative. So I do want to push back a bit on the assumption that data has to be big. And I think that being thoughtful about the data that you have is incredibly valuable. And also kind of just with all the work and fine tuning that does let you kind of transfer some of what you can learn from a bigger data set to a smaller and different data set. So I just wanted to challenge that assumption a bit, although it's definitely, the risk that Jackie opened with of disabled people can be, there's so many forms that disability can take, and that can show up as outliers. Like that definitely is a real risk. But that I think small data can still be powerful if you're thinking about it kind of thoughtfully and creatively.
Thanks, Rachel. And Eve, we're just slightly over time, but a final thought from you.
Yeah. So I think what I learned from this, not just from this panel discussion, but also from my interviews, is the benefit of intellectual humility and knowing that you don't know everything, and seek help when you can, because the problem of bias is too complicated. Not everyone will have one solution or all the solution in the world. And I think it's high time. And I hope that our project has made a head start in terms of providing an avenue for interdisciplinary conversation so that we can start understanding each other. Thank you, everyone.
So thanks so much to our audience. Thank you to our fantastic panel. It's been a great conversation, so much so that it's gone 2 minutes over time. My apologies. And I've really enjoyed it. So thank you, everyone, and enjoy the rest of your day.
Thank you.
Thank you, Stacey.